Hi, I'm Dr. Kenneth Levine. Welcome back to Health Talk. We're seen on the web at weyw19.com, Uverse Channel 19, and in South Miami and further south on Comcast Channel 87. I'm here with Dr. Tom Morrison. Tom, how can people get in touch with your urgent care facilities, get in touch with you?
That's a great question. Baptist Health, and it's www.baptisthealth.net, has an overall website. Within that website, they have patient information, they have information about diseases, they have community outreach programs for health and nutrition. In addition to that, they have where the urgent cares are. There's also an app that you can access on that site for your smartphone or Android or iPhone, whatever the case be, and that app will give you not only the locations but also the wait times for each urgent care. Of interest, the wait times have a 3-hour delay, so you do want to still call, but like I said, our turnaround time is less than 2 hours.
What happens, I know you can call 911 for somebody, do you ever have any resistance from the hospitals as far as accepting patients?
When we first came in, there was some miscommunication, for lack of a better word, because the concept was that we were another ER. We've subsequently had a lot of good conversations with the local doctors and the local hospitals, and since then that has not been an issue.
Well, that's good, because you certainly don't want to have a roadblock where
No.
somebody needs help and they want to be able to, and all you're trying to do is fill in a gap.
Right,
You know,
exactly.
There are many patients that don't have access or don't have a regular doctor, a family practitioner, and certainly not having, I've been to an emergency room, it's no fun for waiting there for 2-3 hours. New Year's Day, I took my mother-in-law to the hospital, and it was like 3 or 4 hours in the emergency room. Everything went smoothly too, and it was just so many different steps to get things taken care of. Well, that's terrific. Doctors that work with you in urgent care, you know, we have a concern in dentistry sometimes that patients go to what I'll call a clinic, and the doctors rotate in and out. How are doctors screened, and tell us a little bit about the qualifications of your doctors.
Well, they are required to meet qualifications to gain credentials within the Baptist Health system, and that in itself is a fairly arduous process. Their background needs to be in either family practice, internal medicine, or emergency medicine. We found that usually those who have training in emergency medicine who have done urgent care, or those who have family practice training who've done emergency medicine, seem to be the best fit. We then, when we find someone who qualifies for the credentials, we have them work with other physicians. So it's a gradual process of working into it. If it's a nice fit, if the personality works and they're happy and we're happy, then we move forward.
You mentioned the physicians. I'm sure that you have administrative staff.
Yes.
You have nursing staff. Do you have PAs also working with you?
Yes, we do. PAs and nurse practitioners. At our busier facilities, we usually have an extender. For the Broward facilities at this point in time, we're just now extending into having a nurse practitioner, but at all times there will be a physician on hand.
At least one.
Yes.
Well, that's terrific. You guys open 7 days a week?
Thank you for asking. We're open 365 days a year. We're open every single day from 11 to 11.
11 to 11. That's interesting. That's a little later than I want to work. In my practice, we actually start seeing patients at 7 o'clock in the morning.
Wow, that's very convenient for some.
It's convenient. Patients love coming in before
bet.
work, and we're done at 4 so I can go to the gym and do whatever errands my wife tells me I have to do. But 11 to 11, because people, you know, they get sick at odd hours.
Well, we found several surges. The 11 to 1 is always the busiest. Those are people who just couldn't get to work because they were too ill. They became ill overnight. They called their family doctor and couldn't get in, or their kids who were called from school. The parent had to come pick them up.
Right.
Then we have another surge after school where the parent picks them up and they're sick, or they're out of work earlier because they're sick, and that's from 3 to 5. And then the last surge is usually at 10 o'clock where people have gone home, they've been fighting it all day, they can't get better, they're not feeling better, they need some help.
You mentioned kids. There's a special training that you need to take care of the little people as well as the big people?
Yes, yes. And again, that's why the family practitioner or the emergency room physician are usually best suited for this job.
That's part of your normal
That's part of the training, yes,
all
sir.
the time.
Yeah.
Well, you know what? This has been absolutely fascinating for me. I've seen facilities, now I know where the better facilities are, and I look forward to meeting with you again. This is Dr. Kenny Levine with Health Talk. We'll see you soon. Thank you.
Thank you.